Hello everyone. We want to create a community outreach program to improve public health in rural villages of Guatemala. We will begin by focusing on issues related to health of our children. Let's start by discussing water and sanitation. Many children die from diarrhea. How does someone get sick with diarrhea? Let's say in a village a man has diarrhea outside his house. A pig comes along and eats around where the man had diarrhea. A child then comes along and plays in the same area, not knowing what had happened there. The mom picks up the child, who then touches the mom. The mom then makes dinner, which the whole family eats. This is how germs spread from one sick person to many healthy people, all of whom then become sick. This cycle repeats over and over again, causing diarrhea to spread easily. The good news is that this is easily preventable. So how can we prevent this? Well, let's think about some solutions. First, everyone should use a toilet. If there is no toilet available, they should go far away from homes, at least 20 meters. Human and animal waste around homes should be picked up and disposed of in these designated, isolated areas. Animals should be fenced and kept away from people as much as possible, especially children. Keep children's fingernails short because germs and worm eggs live under the nails. Keep clean by showering and use soap to wash hands often throughout the day. So there are many things we can do to break this deadly cycle of diarrhea. Children can die from diarrhea because they lose water very quickly. When a child has diarrhea, oral hydration fluids should be given to them. It is simple to make with salt and sugar, and we will make this recipe available to all communities. Make it a habit of washing hands after going to the toilet, before making food, before eating, and after coming home. Teach the children to wash hands frequently with soap from an early age. Hand washing stations should be available throughout the communities. To wash hands, we need clean water. What if there is no clean water? Well, try collecting rainwater. It is easy to do, and rainwater is clean. You should also purify water, otherwise germs that live in the water will make you sick when you drink it. There are two ways to purify water. First, you can put it in a plastic bottle and leave it out for a day if it's sunny, or for 2 days if it's cloudy. You can also kill germs by putting chlorine into the water, but this will have to be measured carefully. The exact mixture will be made available to the communities, as well as plastic bottles used to purify water in the sun. There are 3 other important things we need to discuss to keep our children healthy. First, children need to eat healthy to grow well and stay strong. In addition to corn, they need plenty of nutritious foods. Let's go over some of them. Chicken and eggs are one of the best sources of protein, and they are usually cheaper than meat. Eggshells that are boiled, finely ground, and mixed with food can provide rich source of calcium. Beans, peas, and lentils are another good, cheap source of protein. If allowed to sprout before cooking and eating, they are higher in vitamins. Baby foods can be made from beans by cooking them well and then straining them through a sieve, or by peeling off their skins and mashing them. Liver, heart, kidney, and blood are also high in proteins, vitamins, and iron. And finally, dark green leafy vegetables have lots of vitamins, some irons, and proteins. Super nutritious plants such as amaranth and chia contain much more proteins. We plan to provide lessons on how to grow and cook them in the future. What about things like candies and Coca-Cola? No, these are junk foods and they have no nutrients in them. These foods will cause your children to become sick. Sometimes worms can live inside your children and steal the foods they eat. Although your children may seem to eat a lot, they will be malnourished. That is why it is important to be clean and give them medications to kill these worms once a year. Now let's talk about feeding babies when they are born. Up to the age of 6 months, children do not need anything other than breast milk. The breast milk has everything the babies need to be healthy, even if the mother is not eating well. From 6 months to 2 years old, they need to continue breast milk, but they also need other healthy foods which we have discussed. This is an important time when babies are transitioned from only breast milk to a combination of other foods. Malnutrition is common at this stage, from 6 months to 2 years old, and if not fed properly, they will be permanently stunted with low IQ. This is why as soon as your baby is born, we recommend weighing every month and writing the weight down on a graph. Community leaders, midwives, and health promoters can help you with this, but the ultimate responsibility rests with the parents. Let's look at some examples of growth charts. In the first example, right here, the child is growing well. Although on the low side, the child is gaining weight every month. Now let's look at a second example. In this example, we see that the child is gaining weight until 6 months, but from 6 months to 2 years old, the child is not gaining any weight. This is a sign of malnutrition and a warning sign that the child needs aggressive interventions for nutritious foods. 6 months to 2 years old is a crucial age when malnutrition needs to be detected and treated. Next, we will discuss why we need to brush teeth. This applies to everyone, not just the children. After we eat, little food pieces stick to the teeth. If we don't remove them, germs come and eat those food pieces. Then the germs live on the teeth and start eating the teeth as well. This causes tooth decay, which is very painful. Once you have a tooth decay, it is already too late. Either the tooth has to come out or a big hole has to be made in the tooth at the dentist. It is expensive and can be more painful. There is an easy way to prevent this. Brushing your teeth twice a day, once in the morning when you wake up, and once in the evening before going to bed. If you don't have a toothbrush or toothpaste, it's okay. You can mix salt and baking soda into a powder and use it as toothpaste. You can use a stick end or a stick with a piece of cloth wrapped around the end of the toothbrush. There is also a way of putting fluoride in the drinking water to prevent tooth decays, but this has to be coordinated by your community. It is something you can talk to your leaders about. Finally, let's talk about why we need to vaccinate our children. It may seem very strange that sticking a needle into your child's arm prevents illnesses, but it really does. The needle carries things that protect the children from measles, mumps, rubella, varicella, diphtheria, tetanus, among others. Every year, many children die of these illnesses, but it can be prevented if your children are vaccinated. Take a look at these real photos. This is a child with measles. This is a child with pertussis. And this is a child with tetanus. If they were vaccinated, they would not be sick. Vaccination can be complicated because vaccines have to be given at certain ages. This means that parents have to know when they reach those ages and make sure the children receive the appropriate vaccines. The vaccines also will have to be available and need to be given by trained staff. Finally, certain vaccines need to be kept cold, perhaps in a community cooler. Otherwise, they will not work. Now, we've talked about many things we can do to prevent illnesses in children. For such initiatives to work properly, the entire community needs to come together and work towards common goals. Consider having meetings to discuss concerns and opinions of everyone in the community. Create committees to work on different projects. To be successful, each project will need lots of education and coordination. Let's take some examples. Toilets. We need to educate the entire community on why they need to use toilets, and we also need to make them available. Keeping animals fenced in. This needs to be done at both the individual household level as well as the community as a whole. Making hand washing stations available is probably the most important project. Hand washing needs to become a habit, and the only way this can happen is if soap and water is available anywhere and everywhere for free. If soap is not available, there is a method of making soap using oil, water, and lye. Lye can be dangerous, so soap making should be done away from children by people who are experienced. So this probably needs to be done at the community level. Rainwater catching requires modifications to the home, and so again this should probably be done at the community level. Using sunlight to purify water. The only thing this requires is plastic bottles, but you also need a place to put them and some training in terms of how long to leave the bottles out. Adding chlorine to water should be done at the community level. Teaching mothers how to make oral hydration drinks will require a lot of education, both at the community level as well as during individual home visits. It is very important that all parents as well as older siblings of little children learn this life-saving skill. Vaccination. This is probably the most complicated because first the parents have to know when their children need these vaccines. Then the vaccines have to be available in the community. Also, some vaccines have to be kept cool, and finally they have to be given by trained staff who know how to give injections. Killing parasites living inside your children's tummies. This could be done at the community level or through schools or churches depending on where the medications are kept. Brushing teeth. Education on the importance of dental hygiene can be done at both the community level and through individual home visits. If there is no toothbrush or toothpaste, they can be made, as we've discussed. Weighing children from birth to 5 years old and keeping a record. This will require a lot of education, especially because most parents do not know how to read or write. They need to learn how to keep track of their children's age and how to chart their weights. Also, where is the scale going to be? Will midwives carry them during home visits, or will it be at the community center? And who will make sure it works well? Finally, growing and cooking nutritious foods. Again, education at both the community level and through individual home visits is crucial in teaching the importance of proteins and vitamins for the children. Recognizing early signs of malnutrition, especially between ages of 2 to 3 years old, is crucial. Okay, the last thing we will discuss is record keeping. Record keeping is very important. Each community should know where it stands in terms of its health, and the only way to do this is by keeping record of 3 things. First, births, including complications during labor. Second, deaths, including age of death, because childhood mortality is important data to follow. And third, illnesses, categorized by disease type. We recommend keeping this data for each quarter, and we also recommend following progress for each of the initiatives discussed. To each community, we will make available a brochure with materials used in this video, which can be used during educational meetings. At the individual household level, we recommend that parents keep monthly log of their children until the age of 5, as well as vaccination and anti-parasitic medication log. These logs can be handed out by either the community leaders or during home visits by midwives and health promoters. The midwives and health promoters will play a crucial part in educating everyone in the villages. So we recommend that they keep log of home visits by recording date of the visit and the name of the household. Coordination with the community leaders is crucial to make sure that every home in the community is covered by a midwife or a health promoter. Will there be a designated area of responsibility for each person? Perhaps data and survey results from these designated areas can then be used for accountability purposes later on. To each midwife or health promoter, we will make available a brochure containing materials used in this video, which can then be used as a checklist during home visits. Hands-on demonstrations may be necessary for skills such as making oral hydration fluids, purifying water, and recording a child's weight. After a certain number of visits, or when all the homes in a geographically designated area has been covered, the midwife or the health promoter will receive a certificate and a badge which can be worn. Certified midwives and health promoters are then eligible for the next phase of the program, which will teach them how to treat sick patients. More on this later. Thank you.